the positional release to the lower body. We'll do that with the client having the trousers just to make it easier. However, in reality, you do take the trousers and use underwear to make it easier. I'll show you the draping, which is quite important. Okay? So starting facing up. So we'll just do the draping as such. And you need to do that. Ask them to take their legs to the side. Yeah? Good. And then, you know, when you're taking the legs, drape it this way. Good. That. So, first of all, doing the quadriceps. Yeah. Really, what you need to do is actually stretch. It's like stretching the hamstring. Yeah. So you're taking the legs upway, and then, if the hamstring stretch, that means that the quads are in a lax position. Yeah, you can move more. Yeah, definitely needs it here.
Sorry, can I just stand here?
If you want to do that easier, this is quite hard because you need to hold the leg. Easier would be to bend the leg, but it would not be as kind of effective maybe because you are stretching the muscle as well. This would be a complete lax. Yeah? You can do it like that. Yeah? And you can do that once in a while, moving the leg and even putting it into stretch. Really nice if you have backache. Yeah? You can do it from here, or you can bring the leg and do it on the other side. Okay. And then the good thing is that you can put it into traction diagonally. Or stretching it down. Yeah? If you want to change, you can change position and stretching it down this way. Okay? So this is all what you would do in onto the quadriceps. Now, adductor muscles. So again, what you're trying to do is put this muscle into lax. Now, the problem is that if you do that to the other side, it will be interrupted by the other leg. So what you can do is flex this knee and then put it on the side and then come and attach it from the side this way. Yeah? So this would be laxity, this would be kind of stretching it. Relaxing it. And stretching. You can do a nice stretch also this way. In the leg, not much. You can do this position to lax the tibialis anterior. I don't find it very effective, so I would really leave it. Okay? Come and lie facing down, please. Facing down. You can bend this way. Yeah. Around. Yeah. I'll this one here. Good. So. Okay, very effective for the hamstring and for the gastrocnemius. So the hamstring attachment is from the hip bone to the tibia. So if you bend the knee, you automatically stretch the hamstring. However, a lot of people you would find when you're trying to do that, they have quite a lot of resistance of doing it. And they would help you. This is because the hamstring work quite hard. So I will ask you before starting even, just put your hand there and just do this movement. And then feel, is it really softer? Yeah? Once you get into the position, then you can massage. You can do it this way with your hand, that way, or even put your leg into here, and then you have two hands. Okay? Pretty much the same thing work for the gastrocnemius and soleus. Yeah? So this is a stretch position for them, mostly with the leg this way. If you do it the opposite, if you point the leg and then bring the knee flexed, it's a lot wobbly, a lot more wobbly. Yeah? Just try this. Try to do it this way and try to do it this way. You would see that the laxity of the muscle is a lot more this way. So it's a lot easier to work. You can work it that way. You can massage it with petrissage, compression, but it's a lot easier. The position itself helps you. Okay? So again, hamstring, gastrocnemius and soleus. Turn around, do the quads and the adductors. Yeah? That probably would be enough. Maybe I can show you one more that I really like. Come and lie on your side. Yeah? We'll take this. It's not helping. I really want you to see. See? Yeah? Bend your knees. Yeah? Good. And that's the erectospinae and maybe you can come from around here. The erectospinae and the quadratus lumbarum muscles from the side. Yeah? So if you bring the hip up, you lax the muscle. So you need to put your fingers there on the muscle, and then every time that you lift it up, the muscle would be relaxed. Yeah? Really good way to work on tight muscles. And then you can do the opposite by stretching it. Yeah, again, trying to open it and close it. And it's like a sponge, you know? You're stretching, opening, stretching, opening. By you doing that, you're actually creating a pumping effect into the tissue. And the blood circulation will get better by itself, yeah? Yeah? So try that as well. Very, very effective technique onto the QL and erectospinae. And everybody's having backache, yeah? So it's going to be quite good. One more maybe. Gluteus muscle, they attach to the femur. If you stretch it this way, you're tightening it. And if you're doing that, you're relaxing it. Yeah? Yeah? Why? The gluteus attached from the sacrum to the femur. So when you take the femur and roll it in, you see, you do rolling in, then the distance between the femur and the sacrum is shortened, and that muscle is in laxity. Now you are stretching it. Yeah? You stretch, so you can work on the gluteus with laxity. Yeah? This would be easier. Yeah? And this would be stretching it. Yeah? I want you to palpate it and see if you can get the grip of the feeling. Okay, I'll come and help you in how to move the knee. But generally, put the knee in 90 degrees and then move it this way and that way. I think it's enough. Mm-hmm. Yeah? Cool.